brain health seems to be the phrase of the moment in MS. It's a very important topic, and it's also an area of the disease where we, the patients, can actually exert some control. Before we start, though, just a quick reminder to like and subscribe if you want to see more of this type of content. It tells the algorithm to adapt to your preferences. And there's also a Patreon for this, themsguide.com. So it's not cheap to run this channel, and I do it voluntarily. It costs you less than a cup of coffee a month to help out. And all the details are in the video description, and I'll probably pop it up on the screen. Anyway, to the far more interesting stuff. Today, I'm joined by an MS neurologist who is an expert on the practical side of MS brain health. And I'd like to welcome you, Augusto Mirabelle, MD, who's the lead MS neurologist at Rush in Chicago. Hi there, Augusto.
Hey, Dominic. Thank you for the invitation.
Could you do me a favor, please, and not only introduce yourself, but I don't know, maybe it's being in the UK. Tell me what Rush is. I presume it's a hospital, but I'm not entirely sure. So before we get into the brain health, tell us about yourself and what Rush is.
Absolutely, Dominic. Glad to do that. So, yeah, I am a neurologist. I specialize in multiple sclerosis and neuroimmunology, and I served as a chief for the MS and neuroimmunology division at Rush. So, Rush University is located in Chicago. We are the largest MS center in the region. We care for over 3,000 patients in our center, and I joined this team a little bit over a year ago. Prior to this, I was in Colorado.
Right. Okay. That explains some things. So we're here, though, because of brain health. Can you please give us a brief summary of what is meant by MS brain health and why it's important? But before you do, I'm just going to say, all I've heard for the last year is about brain health. So I'm really hoping you can help us sort of unwind this a little bit. And please, I beg you, make it simple.
Yeah, and actually, I'm glad that brain health became this buzzword that everyone is talking about, and it's about time. I mean, we've been talking about disease for the longest time, and now we are shifting to talk about health. And so I think the American Academy of Neurology came out with a good definition of brain health, which explains that brain health is this continuous state of attaining and maintaining the optimal function of the brain to best support our physical, emotional, cognitive, and social life through every stage of life. And the reason I like that definition is because if you kind of dissect the different elements, it speaks about this continuous state, understanding that we never graduate from having optimal brain health. This is something that we continue to work every day. And there are going to be setbacks. There are going to be moments in which we are not doing everything we can to maintain that brain health, but we can always go back. We can always continue to improve our health. And I also, what I appreciate in the definition is that reminds us that no matter how old or young you are, there is always something we can do to optimize the function of the brain. So this concept of the continuous state through every stage of life gives all of us hope.
Can I ask you a question? Because certainly in the MS world, where we both exist a lot of our time, I always hear about MS brain health. Now, there's a bit of me which thinks good health is just good health and really good. But can you explain possibly why it's, should we say, more important or more significant? I don't know, when you have a neurological condition, particularly in this case, MS, which shrinks our brain, attacks our brain, does horrible things to our brain.
Absolutely, and you're correct. So yeah, there are certain elements of brain health that applies to everyone with or without MS. But we are now starting to understand more specific recommendations for MS patients. And why is that important? Because as you mentioned, MS is this chronic disease that will continue to affect the function of the brain, even despite the use of highly effective therapies, which I think it's becoming the norm, hopefully, in MS patients. We still, even those therapies don't still address all of the potential consequences of MS in the brain. So I think that's why it's important to incorporate lifestyle interventions that have proven benefit anywhere from exercise and healthy nutrition and sleep and management of comorbidities. I mean, all of those are important pillars for anyone, but
Hmm.
more importantly for MS patients.
I think that's super important because, well, firstly, when you're diagnosed with MS, I think everybody should be given a year at least just to get their head around the fact that they've moved from the kingdom of the healthy to the kingdom of the sick, which is a phrase. I can't remember the name of the author, but it's and we're now going to live our entire lives in the kingdom of the sick because it's incurable. So it's this awful feeling of loss of control. You're at the mercy of the doctor. I mean, people like you, I have to go and sit there and you say, give me blood, do this, do that, take this, don't take that. And what really strikes me from everything I've heard about brain health is, oh, this is something that I can do to
Right.
get on top of this bastard disease. It's just, you can give me the drugs, but there's other stuff. It's, as somebody said to me the other day, it's the hard work. Many people want the
Absolutely.
hack, which is to give me a pill, doctor, make me
Yeah.
better, make it all go away. But there's no other way to camouflage it. It's hard work, whether you're investing your time making friends and growing your social circle because your social environment is good for your brain health, or it's going to the gym, something about which I know all too well. But okay, so you founded a non-profit, and for those of us who are not in the US, and that includes me, just think charity when you hear non-profit.
Right.
You know, you founded it in Colorado with your wife to focus on brain health. Can you share with us a bit about the Brain Health Center of the Rockies and the programs you run in both Chicago and Denver?
Yeah, so they're correct. In 2019, my wife Kathy and I we founded a nonprofit, the Brain Health Center of the Rockies, and the main goal for that is to educate communities, patients, on the importance of brain health. And our most robust programs are dedicated to MS patients, but we also have programs for Parkinson's, for dementia, and for healthy aging. And why did we do that? Well, I think we understood the importance of brain health, but also we recognize the gaps that we currently have in our healthcare system to truly empower patients through knowledge. And something that you said that resonates with me is this framework shift that is occurring to not talk about disease as much as to talk about health. And that's important because that empowers people, gives individuals like yourself, with people with MS, now control. You now have an opportunity to take control of your life and impact your healthcare outcomes through the lifestyle choices that you make. But how you do that is difficult. And so the point of our nonprofit is to help individuals like yourself who wants to, take control of your life, understand the why, but also understand the how.
Oh, Gus, I couldn't agree more. I've run this channel for nearly 4 years now. I've been involved in the community. I've had MS for 32 years. I always think I'm fortunate to not be as ill as some of the people I know, but I'm not fortunate to have MS. But you can't change that. But one of the resonating constants, there's two things that MS patients always say. If you ask them, you say, when did you get diagnosed with MS? And I'll give you a date, and they'll follow it up with, but I knew X and Y beforehand. And then if you dig into it, it's a complete lack of control that people don't like. And it's like you're on a boat that's lost its engine and it's in a storm and the sail's down and you're just being tossed around. And all of a sudden, there seems to be this, oh, let's involve the patients. What can the patients do? And guess what? We're pretty powerful people and we know ourselves best. So I just like you to double down on the results that have been experienced by the MS patients that have been fortunate enough to take part in your programs. Because, no offense, Augusto, I haven't met a neurologist that doesn't look at something and think, how can I get a paper out of this? So it's wanting to know how you guys have measured it. I mean, how it's helped people, because we can talk
Yeah.
about this in the abstract, but really what it means is how has it changed people's lives and improved their day-to-day life and their longer-term outcomes?
Yeah, it's interesting to say that because, to be honest, what resonates with me is the one-on-one subjective feedback that I get from individual patients, right? So
Hmm.
how we can impact everyone and anyone, regardless where they are in this disease state. And unfortunately, that's not publishable because most journals, most articles want to have an aggregate data on how are hundreds of patients doing. So
I
we
disagree as a social scientist, and I did history and politics. There are way it doesn't really fit in the medical paper type of thing. I understand that, but yeah, I think we should we
yeah,
should
but
we should
so
get our heads together and do something later.
right. So we are forced to have that data as well. But to
Yeah.
be honest, what resonates with me is the individual patient that comes to me and tells me, like last week, a patient was drinking sodas every day. And we talked about the importance of,
You mean sugar
keeping your
drinks?
sugar drinks and minimizing that. And he just sent me an email saying, I after 3 months I stopped drinking sodas. And I think
Oh.
that's those are small battles, right? But I think they're so meaningful. And again, you can't publish that, but I think it's important. Having said that, I think that when we look at things like improving healthcare literacy in patients, 90% of our patients improved at the end of this 2-week program healthcare literacy. 89% of patients at the end of the program understood the difference between MS progression versus worsening, which is very
Hmm.
important.
Oh yeah.
Understanding, am I feeling worse because my MS is getting worse, or I'm feeling worse because I need to exercise, I need to do more things to keep active. So we capture outcomes before and after the programs. But as I said before, I think the most meaningful ones, the ones that actually resonate with all of us, is how we can positively impact individual patients, even if it is in a small portion of their life. I think in this disease, we all need to work together to understand that a 1% improvement in something is meaningful.
I read a paper yesterday, the day before, because I'm a bit of a nerd, and in multiple sclerosis and related disorders, it's called MSR, about the researchers, the sort of folks from your end had quantifying all this stuff, and it's just you look at it and think it's really hard. Like you say, it's this anecdotal evidence where I go, "Hey, Augusto, I'm feeling 10 times better."
Right.
That's for me. And every doctor I know wants to put it on a scale and then compare it. And the fact is, the best way I've ever heard it, when I was lying on the road, I'd broken my femur cycling, which really smarted quite a bit. And they said, on a scale of 1 to 10, with 1 being the least and 10 being the worst, how much does it hurt? And I said, about a 12 or 13. And yeah, but it's just, is all they want to know is how I experience it. In
Right.
my world, that was a 13. And but it's important, I think, I find when talking to people is what doesn't hurt for me hurts for somebody else, and that type of thing. And fatigue, fatigue scales, and they want to make everything on a scale. And but my 5 isn't your 5.
Right.
Which is this is the whole personal side, which I think, frankly, some doctors struggle to feel comfortable with. I wouldn't say get their head around, that's wrong, but to feel comfortable with my reporting to you if you're my doctors, and for you to say, okay, for Dominic, that's a 10. I think he's crazy, but for him, that's a 10. Uh,
Yeah, and
yeah.
and then there are other outcomes, Dominic, that we tend to forget, which I think is very important, like participation. I think being able to help a patient re-engage in life, in society, in social activities, that need or drive to participate in things is important. And unfortunately, MS directly or indirectly can affect that, whether it's through fatigue or mental health or depression or
Mm.
just being scared. So I think sometimes helping people take the first step to participate, to be engaged is very important.
Oh, there's a really good patient forum called shift.ms, which I'm on. I've kind of got a foot in both camps. And there was a lady there yesterday who said, I've been diagnosed here. My long term partner has just walked off saying they want to go and do a really sort of exercise based lifestyle. And now I can't keep up with them. And she was hurt, to the core. But the fact is, something that there's other people that can say, yes, no. I've got a very much like, well, then he wasn't the one for you sort of thing, but it never sounds as sympathetic as it, as I mean it. But it's still the having people around you. Can you imagine that if you're on your own and
Hmm.
had nobody to talk to, and you're just thinking, is my life going to go down the plug hole now? And there's other people around to go, it's not the end of the world. It feels like it.
Oh, Dominic, as a matter of fact, when you look at the most impactful risk factors for dementia, this is outside of MS, but if you just look at brain health
Yeah,
on a broader
it's still
spectrum,
the brain.
social isolation is as hurtful for brain health comparable to smoking. So
Mm.
being alone and feeling lonely is as detrimental to our brain health as, for example, smoking. So I think, to your point, we need to help our patients find ways to be engaged socially, cognitively, and physically.
I think of the popular entertainment thing. There was that film with Tom Hanks on the island. He carved himself a friend out of a coconut because he needed to interact with somebody. But you think that's actually serving a mental health thing. So I don't want to go crazy, and I can, it's a coconut, but I make it another person, and it's the best I've got.
That's correct.
So Augusto, I know you're super busy, and I appreciate you giving up your time, but it's just a couple things that I wanted to say that involve you. Uh, and that is, folks, the msguide.com, who's essentially me. I feel so passionately about the importance of MS brain health because it involves us, the patients, that we have partnered with the Brain Health Center of the Rockies, which is Augusto, to raise $1 million in support of international MS brain health initiatives. MS occurs everywhere. It's not an American or a British or an Australian thing. So our whole aim is to have this so that international bodies can come and say, we're running an MS brain health initiative. Can you help us out with some funding? So the way that we're going to do this, as opposed to just put our hands out, it's my view that people like to see someone suffer before they donate money. So that'll be me. I'm going to cycle 8,000 kilometers, 5,000 miles, depends where you live and how you express it, but 8,000 kilometers sounds more impressive, I have to say, across Canada in May in 2025. And the Brain Health Center of the Rockies is handling all the financial donation side and everything like that. And they're advising, and we're working in partnership to ensure that this money is spent on the right kind of programs or giving people the right support, because it's not always just the money, it's the right support to enable these kind of programs. So it'll take me about 4 months if everything goes to plan and my brain doesn't explode or my legs. But there'll be a load more on the msguide.com documenting this. You're going to see Augusto again. I don't know if he realizes this, but I think I'll just share that with you. And we will be talking more about brain health because it's all about what we can do as patients to fight this disease by intervening. Our brains are our most precious asset. So we're going to do everything we can to keep it that way. Okay. Augusto, thank you so much for coming on the msguide.com to help us understand what brain health is and why it's so important. And what I would like to do is check back in with you to talk about some practical things that have really worked for some of the people on your program, and also examples of patient leadership where people have internalized what's on the program and they've gone to spread the word, because I think we're the most important people to help ourselves.
Absolutely.
So
Well,
thank you.
thank you, Dominic, for everything you do. You are so inspirational, and you keep us all going.
You embarrassed me. Thank you, Augusto.